Welcome to a virtual journey to the future of medicine, where we'll learn about a major therapeutic advance, gene therapies, and their potential for the treatment of haemophilia. Let's start this journey with a familiar event, a simple injury. Now just imagine that you could travel through these injured blood vessels. This is what you would see. Right now you are facing the breach in the blood vessel wall and the blood flowing out of it. This explains the bleeding. But you also see blood platelets trying to seal this breach. To achieve this, blood platelets change shape. In other words, they become activated, stick together, and clot the blood vessel injury. To consolidate this first clot, blood platelets will need the help of other actors. They're known as the coagulation factors. By interacting together, our coagulation factors lead to the formation of a kind of net. This net gradually traps red and white blood cells and other blood platelets. By doing so, it creates a stable clot, which will eventually seal the breach in the blood vessel wall and stop the bleeding. The production of these coagulation factors is not a coincidence. It is precisely programmed in a kind of control room located deep in our cells. To learn more, let's travel inside one of our cells, inside its nucleus, among these DNA strands. In other words, we are now traveling in our genetic ID. But why genetic? Actually, our DNA strands can be divided into thousands of smaller parts or fragments called genes. Each of these genes contains the necessary instructions enabling our body to perform its daily tasks. And one of these genes is responsible for the production of the coagulation factors that we've just seen. But with some people, these genes can be modified or altered. We then speak of a mutation. As a result, the necessary instruction to create coagulation factors is then missing. This is what happens in the case of haemophilia. In the case of haemophilia, if we travel back in our injured blood vessels, we see that since the coagulation factors are missing, a stable clot cannot be formed and the haemophilic patient will keep bleeding. Fortunately, up until today, it could be treated this way.
I
was diagnosed with haemophilia a few years ago and have lived with it ever since. There is a treatment and I have to inject myself. Of course, I have to take all my medication with me when I travel, and there's always the risk of infection.
Il y a aussi parfois des petits problèmes d'infection, donc c'est vrai qu'il y a des solutions, mais c'est un petit peu contraignant aussi.
Today, however, thanks to major advances in genetic research, another therapeutic solution can now be considered: gene therapies in haemophilia. How do these gene therapies work? We've seen that the lack of a coagulation factor is linked to a deficient or mutated gene. Today, it's possible to recreate in a laboratory environment a functional copy of this mutated gene. It can then be integrated into a kind of vehicle in order to inject it into our organism. Our gene will then travel to the center of our cells, where the mutated gene resides. Once inside the cell nucleus, it will enable them to start creating coagulation factors. So in the case of a wound or injury, the coagulation cascade will be activated and stop the bleeding. Gene therapies are a major breakthrough, which will definitely change the treatment of certain types of haemophilia, and their potential will be applied to bringing new perspectives to millions of other patients.